So here are some topics we need to focus. So in this video, I am going to present only few topics, that is types of parental solutions, BMI, that is body mass index, ABG normal values. In other videos, I will keep ABG interpretations and lung volumes and ECG interpretations. Coming to types of parental solutions, we have three solutions. First one is isotonic solutions. These are the solutions that have the same concentration of a solute, and examples of isotonic solutions are normal saline, that is 0.9%, sodium chloride, ringer lactate, and 5% dextrose in water. So sometimes a question can be asked, isotonic solutions except or isotonic solution example, like that. So NS, NaCl, Rl, 5% dextrose in water. Coming to second one, hypertonic solution. It is one of two solutions that has a higher concentration of solute. So examples are 5% dextrose in normal saline. If you observe the difference, for isotonic 5% dextrose in water, whereas in hypertonic 5% dextrose in normal saline. DNS 10% dextrose in water, 3% NaCl. So if an example is asked to pick up the hypertonic solution, then you can see this. If these are present, then you need to take that answer. Coming to hypotonic solution, it is very easy, where only one is there. So it is one of two solutions that has lower concentration of a solute, that is 0.445% NaCl. Coming to second topic, BMI, that is body mass index. Sometimes they will give you BMI value and they can ask whether they come under underweight, normal weight, overweight, or which type of obesity. So we need to know the normal values. So if the BMI value is less than 18.5, underweight, 18.5 to 24.9, normal weight, 25 to 29, overweight, or it can be obesity, 30 to 34, that is class 1 obesity, 35 to 39.9, class 2 obesity, that is severe obesity, more than 40, class 3 obesity, that is morbid obesity. So they can give you the values and they will ask you to choose which type of weight they come under. And we do have BMI formula, so I'll be uploading in the next videos. This is just for your idea. Then coming to lung volumes, we have lung volumes like tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. Tidal volume 500 ml, inspiratory reserve volume 3000 ml, expiratory reserve volume 1200 ml, and residual volume is 1200 ml. Coming to ABG values, so normal values we need to know in order to interpret the whether it is metabolic acidosis, respiratory alkalosis, like that. So for ABG, normal pH value is 7.40 is normal value, range is 7.35 to 7.45. Coming to PaCO2, that is partial carbon dioxide, normal value is 40 and the normal range is 35 to 45. Coming to HCO3, that is bicarbonate, normal value is 24, whereas normal range is 21 to 28. PaO2, that is partial oxygen, normal value is 100, normal range is 80 to 110. But in order to interpret ABG values, we will be using only these three, like pH, PaCO2 and HCO3. Coming to ECG changes and related conditions and how to interpret. So in case if there is prominent U waves in the ECG, then the condition can be hypokalemia. If there is peaked T wave, that is hyperkalemia. So peak, so you can remember hyperkalemia. If there is widening of QRS wave, then it can be hyperkalemia, or it can be due to tricyclic antidepressant poisoning. So if the patient is taking antidepressants, due to that tricyclic antidepressant poisoning also, there is a changes in the ECG that can be widening of QRS. And our favorite thing is ST segment elevation, mostly we can see in myocardial infarction, and this is repeated in many of the question papers. And prolonged prolonged QT interval, that is hypocalcemia. Shortened QT interval, hypercalcemia. So if it is prolonged, hypo; if it is shortened, hyper. So it is opposite here. Flattened or inverted T waves, it can be hypokalemia or coronary ischemia. So these are some topics. So I'll be uploading other topics in the upcoming videos. Please subscribe my channel.